Hello, this is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. On this video today, what you'll be learning about and what I'm about are ways that you can be managing your musculoskeletal pain given our current environment, dealing with shelter down and social distancing during the COVID-19 outbreak. So today is April 7th, 2020. And for most of us in the world, really, certainly in the United States, we're dealing with a situation where we are sheltered down, limiting our exposure to different people, limiting our exposure to our normal activities and work in really significant ways. And while all that is incredibly important in terms of managing the risks associated with COVID-19, the reality is that we still have our normal issues going on. And when it comes to musculoskeletal related issues, whether it's injuries, arthritis, tendinitis, back pain, neck pain, these are still issues that need to be managed, optimized, dealt with. And so if you're out of your normal rhythm, normal process of trying to manage those things, whether that's help that you get from your physical therapist, physicians, other types of healthcare providers, let's talk about what you can be doing right now to really optimize things in your life so that you can manage this better. So, how to manage pain while social distancing. And the reality is I'm getting a lot of questions about, hey, doc, what should I be doing at this stage? I've got problem X or problem Y, and I'm kind of limited with what I can normally do. Please give me some suggestions. So here's what people are doing now. A lot of people are relying on anti-inflammatory medications. They may be relying on narcotic pain medications. They might be using a lot of ice. Due to gyms being closed, limited ability to get outside as well. People are avoiding exercise, and a lot of people are doing nothing. So there's problems with all of these things. As an example, when it comes to pain medications, the same issues exist with these meds, whether it's in the middle of COVID-19, outside of that during normal times, meaning narcotic pain meds are not a great option long-term. They can give you pain relief, short-term, necessary pain relief, but long-term, obviously, a lot of issues with taking chronic narcotics when it comes to opioid dependence and the issues associated with that. Anti-inflammatory medications, and what I'm talking about are non-steroidal anti-inflammatory medications, including ibuprofen, Advil, Aleve, Celebrex. The issues there are, if you're using too much of it too regularly, it can increase issues like stomach ulcers, kidney damage, liver damage, heart disease long-term. They may be sold over the counter and they may have a benefit in really short-term usage, but understand that if you're using this long-term, that could be weeks, months, or years, even weeks, that you do then increase your risk for other things as well. So again, we need to be aware of our risks and issues that we're dealing with that go beyond just infectious disease and COVID-19. So I'll talk about some other options that can be helpful there. Other things that people are relying on include ice. Ice short-term is fine. Long-term, it's, again, there's possible issues from a healing environment, but short-term it's okay. But again, it's not the ideal thing to be doing. Avoiding exercise is obviously not ideal. I can understand if people have pain, they're trying to limit their exposure or interaction with activities that are causing problems. But I'll talk about what else you can do to get back on track. The reality is that exercise and strengthening and flexibility has an important aspect in terms of dealing with pain and optimizing your body. And then lastly is doing nothing. I think a lot of people, because they're out of their normal rhythm, they're really doing nothing to manage their pain. And they're just kind of dealing with it and living with it. And I think it's a problem because short-term, obviously people are suffering. Long-term, it's a problem because we're really not sure how long this is going to go on for. We have a sense that we're dealing with something acutely with COVID-19, but there'll be some repercussions going on for some time, at least for the next few to several months. And we're really not sure if there's going to be sort of a bounce back in terms of shelter down rules when it comes to the fall or winter time again. So I think it's in your best interest to be thinking about what you can be doing, not only right now, but how can you be optimizing your routine and life so that you can be handling this in a longer term nature as well. And so look at this as an opportunity to rethink, reevaluate, and try to do things even better. So what are some things that you should be doing now? So here's a couple kind of obvious ones right off the bat, and here's some solutions for those obvious ideas that may seem hard to do right now. Number one, exercise. I don't know how many people have exercise in their homes exercise equipment in their homes that they've sort of let go over time. The classic is the exercise cycle or gym equipment that someone's no longer using, and now they're using more to hang their clothes on. Obviously, let's maybe dust some of that off and consider using some of that. If you can use that equipment in a manner that allows you to stay functionally active, low impact, doesn't cause more pain, but does get you active with better blood flow, muscle contraction, more strengthening exercises, I think that's a great option right there. Use what you have right now. In that regard, there's a lot of calisthenics that you can be doing, whether it's push-ups, squats, other types of abdominal exercises, planks. If you've got a TRX ropes at home, great option right now. Understand that in the world that we live in, there are videos for exercise everywhere on the internet, whether it's YouTube, people's websites, where you can learn to do things on your own in a low impact, safe manner that I think can keep you continue to be physically active. It's going to take a little bit of creativity. It's going to take a little bit of effort, but I think that's certainly worthwhile trying. Another option is telephysical therapy. I did a video a few days ago, last week, with physical therapy colleague of mine, Keith Travers, where he sort of showed me how you can actually manage physical therapy online. And it's a great option because it's available right now. And what's cool about that is they can do a lot of what they need to do in terms of evaluation and guiding you and teaching you in terms of getting better at doing some of those exercises on your own. So that's a professional way of getting some guidance to get back into physical activity. There's a bunch of trainers, a lot of trainers that are now starting to adapt to this remote environment where they're doing doing training sessions online. The trainer and Pilates instructor that I work with has started to do a lot more remote training as well. So again, great option to either stay in your own rhythm and regimen, or even to create a new one, right? To utilize the technology that's readily available for everyone, with our cell phones, our laptops, our computers, and working with people that can still offer you value right now. Another option, if we're talking about avoiding pain medications and things like that, what else can you be using that has some value? And so there are supplements, over-the-counter supplements, that can be helpful. Glucosamine chondroitin can help a significant number of people that have wear and tear arthritis. Turmeric has been shown to be helpful for knee osteoarthritis, and equally as helpful as anti-inflammatory medications. And omega-3 has been shown to be helpful in people that have inflammation in the joints. So again, these are low-risk options that I think have value, that are certainly more safe than taking chronic narcotics or anti-inflammatory medications. None of these may be a sort of magic bullet in terms of dealing with your pain, but each one of them incrementally can get you benefit and relief and get you closer to pain relief, functional improvement, and better quality of life that is worthwhile considering. I think it's worthwhile considering all of these because if each one can help you 20, 30%, that gets you to a much better quality of life. Other things that we should be doing in general, a lot of people don't, but that are certainly worthwhile right now. Number one, stress management. Stress makes everything worse, realistically, whether that's the experience of pain or realistically any other medical condition. I think the amount of stress that everyone is dealing with right now. There is such an overwhelming amount of negativity in the world right now, dealing with what everyone is dealing with COVID-19. It's a lot. It's a lot. And so, if that is a significant component to this, and I think it is for probably most people, you need to consider the tools available that can improve things. Meditation. If you don't have a meditation regimen, I mean, strongly consider doing that right now. If you've got time to incorporate that, use the tools that are available. Headspace is a great online app that you can use that can help with learning how to meditate, but there's a bunch of other ones as well. Whether it's working with people to learn how to do it or utilizing free or mild cost sort of apps and other kind of tools. Super important. Stress reduction and meditation is a great option for not only right now dealing with stress, but even long-term dealing with pain and stress. Another one that I think is important is gratitude. I make it a point every single day to think about the things that I'm grateful for and happy for, because I think that's an important aspect of stress reduction, giving perspective and dealing with stress and pain and difficult times. Gratitude, huge, huge. And strongly recommend formally incorporating that into your life, not just when it feels right, but making it a part of your life as well. Other things to consider, dietary nutrition. I'm very fortunate that my wife is extremely on top of this issue for me and for our family. And I think this is a key part of life in general, but certainly when it comes to pain. A low inflammatory dietary approach makes a lot of sense. Some general guidelines: limit carb ingestion, limit refined sugars. Generally, a plant-based diet is better from a low inflammatory approach. Other things to consider: if you know there are certain food types that you don't respond well with, where you have some degree of inflammation that occurs, limit those. It may be hard to do some of those things due to people's limited ability to get out of the house, but what a great opportunity to learn more about that. What a great opportunity to incorporate some of those concepts in your own cooking and meal preparation at home as well. So I think that's super, super important. Next, without a doubt, if you need more medical advice or evaluation, you still have that ability to do that. So telehealth, which basically means, or telemedicine, which means being able to connect with your trusted health advisor and physician to go over what's going on with you, I think is really important at this time. Whether that's just getting perspective in terms of how you're doing, certainly for patients of mine that I know well, I think it's helpful to have a conversation, look each other kind of face to face and figure out what's going on. How can we manage things right now? Having a perspective and trust with someone who knows your condition is certainly helpful at this time to help manage things, slightly adjust your regimen in terms of how you're being treated. If you've never been evaluated and you need a diagnosis for your pain, that's still an opportunity as well. You can certainly get a diagnosis by working with a physician who can work with you via telemedicine. You can get 80 to 90% of the information that's needed to help get you on the right path to not only a diagnosis, but treatment. You can do that right now as well via telemedicine. And then, on top of that, if you have something that's already failed conservative treatment and you need to be thinking about regenerative medicine treatments, such as platelet-rich plasma or bone marrow-derived stem cells, this is the time to be doing that as well. How do you do that? Well, if you can work via telemedicine, you can certainly connect with a physician who knows and understands these kind of treatment modalities. They can talk you through how to think about these things. Are you a candidate? Review your additional testing you've already had done. Order other testing that may be needed. You can do all that right now. You don't need to be passive and wait. You can get started on that right now. You may not get a procedure right now, but you can be prepping for that. A lot of the prep work before that includes things like adjusting your diet, maybe adjusting some of your medications a couple of weeks before treatment as well, getting on the right supplements, trying to get involved in the right sort of exercises, get the right imaging done. So there are some steps involved before you even can proceed with regenerative medicine treatment, but you can get started with that evaluation process right now. Telemedicine and the tools that are available make that very easy. Lastly, I think it's really, really important. I think a lot of people in the general public are starting to think about risk in a different way. And they're thinking about not only the risk of their exposure to COVID-19, they're thinking about risk about what treatments they're taking now. They're thinking about risks of traditional treatment versus other treatments. And this is a great chance that you can start thinking about that either on your own with people that you trust, your trusted physician advisors, about risk versus benefit analysis. And what that means is think about if a traditional form of treatment for musculoskeletal pain, arthritis, tendinitis, back pain, or injuries are steroid injections. How does that compare to a regenerative medicine treatment? A regenerative medicine treatment has a lot lower risk than a steroid injection. A steroid injection increases your risk of tissue damage and infection risk and affect even the hormone axis in your body in different ways that are not ideal long term. This is a great time to think about those kind of things. That are there lower risk options that can get you better relief? It's also a good time to think about how do you consider some of those lower risk regenerative medicine options to things like surgery? What's the risk? What's the benefit? There's certain risks that you don't have with those kind of injection procedures that you do with surgery. And you may be able to get a similar or better outcome in some cases compared to traditional surgeries. This is a great time that if you're thinking about some of those treatments, to really be thoughtful about risk and benefit. The more you can think about it, the safer things will be for you and the better and more thoughtful you can make decisions. It's an opportunity, I think, more than anything else for us, where we have a little bit of a pause in life right now, where we can rethink how we're living, how we're pursuing treatment, and how we want to move forward in life. And I think there's a wide spectrum of ways that you can improve musculoskeletal pain. And this is a great chance to think and learn about that. Love to hear your thoughts. If you'd like to send me questions, you can reach me on any of my social channels or via the website, chicagoarthritis.com. If you'd like to learn more about treatment options available, check out the website or check out our content. Have a good day, live well, be safe, and be healthy.